U.S. healthcare model focusing more on managed care and patient-centered services, it isn't surprising that the health information technology arm of reform is modernizing at great lengths. One particular innovation has taken off and branched out into all elements of patient care. That innovation is the development of healthcare-driven patient portals. The Center of Medicare and Medicaid Services defined a patient portal as a secure online website that gives information from anywhere within the internet connection. Alfano, 2016. We will move forward by exploring the utility of patient portals and review the stakeholders that support this concept. We will also mention its impact on the patient as we build on the inception of its growth.
The case presented in this slide is taken from the research study of Rachel Hess, in which he used to identify the effectiveness of portal technology for chronic disease diabetes. The study identified a number of elderly users who are using patient portal technology, especially those who are educated and are living alone. Another study by PCAD has also identified the use of portal among adults. However, this study also discovered that adults of the same age group and education but are living with families do not use patient portal technology, which means that the purpose and benefits of this technology are not clear to most patients.
Problems that are solved by portals. 94% of providers report that EHR or electronic health records make records readily available at point of care. It also produces clinical benefits for the practice and allows providers to deliver better patient care. Having access to patient portals gives providers access to a patient's complete health information. EHR not only keeps a record of patients' medications or allergies, but also automatically checks for problems whenever a new medication is prescribed. Accurate and complete information about a patient's health, which enables providers to give the best possible care, whether during a routine office visit or in a medical emergency, by providing the information they need to evaluate a patient's current condition in the context of the patient's health history and other treatments. The ability to also quickly provide care. In a crisis, EHRs provide instant access to information about a patient's medical history, allergies, and medications. This can enable providers to make decisions sooner instead of waiting for information from test results. It also provides the ability to better coordinate the care they give. This is especially important if a patient has a serious chronic medical condition such as diabetes. It's also a way to share information with patients and their family and caregivers. This means patients and their families can more fully take part in decisions about their health care.
Been delivered through two ways. In one way, it focused on healthcare providers to help them in their administrative chaos, while in other way, it focused on the development and convenience of patients. Both the systems collectively aim to enhance healthcare system efficiency and transparency to improve overall healthcare system of a country or state. Moreover, HIT increased the capacity of hospitals to store massive data and allowed it to quickly access or share with patients or other healthcare organizations for future development. HIT introduced ways to provide timely healthcare services to patients in remote areas with the help of web-based technology. HIT has been delivered in different ways to improve the efficiency and transparency of the healthcare system. Currently, most of the healthcare information technology is based on internet that is helping physicians and customers to keep in touch as well as allow healthcare providers to record patient data in a more secure and accessible way. HIT is mainly delivered to improve the infrastructure of hospitals and clinics, as well as to help the administration and medical staff to access their required information within seconds. The HIT that helps in connecting patients with physicians and hospitals from their homes and offices is currently in its growth stage that needs to be developed. The users of patient portal technology are mainly of two types that are further classified in different categories. The major two categories are given in this slide. The healthcare providers are like sellers who are purchasing these technologies from manufacturers and designers of the patient portal software designers and are then selling or providing their services to the end customers. On the other hand, end customers or recipients are the final customers or users of this system who are getting the benefits, and without them, the technology is useless. Therefore, the focus of the healthcare providers is mainly on attracting the second group or category of the users. The healthcare providers include hospitals, physicians, nurses and nursing homes, and clinics, who are the main buyers of HIT software and systems like patient portal technology, who are purchasing these technologies from software designers and are implementing it to assist and help customers or patients. Patients are the end users or recipients of these services, who are using these technologies to stay in touch with hospitals and healthcare providers. Providers are already convinced of the benefits of this system. However, they are facing issues in convincing the end users or patients to use this technology who have concerns over its security and confidentiality status. Healthcare providers are very much positive about the benefits of patient portal technology because they help them to successfully implement HIT to achieve a good and transparent healthcare system. Using this technology, hospitals and physicians can easily help and access the health record electronically and can also share with relevant patients. This technology made patients as partners in healthcare system and encouraged them to openly communicate different health-related issues to maintain good health without visiting the hospitals or physicians. Moreover, the system is actually empowering the patients, which will help in developing a patient-oriented healthcare system and will promote home-based disease treatment, especially for remote areas. The thoughts of patients are kind of mixed, as some patients are satisfied, some others are not satisfied, while some of them are not clear about it. Many patients believe that this system is only for elderly patients who are independent and are living in private residence. Some others believe that the system is good to use for consistent support from the physician post-injury or post-trauma. There are some patients who have negative thoughts about this system due to the security loopholes that needs to be resolved for eliminating the concerns of patients regarding their confidential information.
Acquire patient portals. So there are various ways that one could acquire a patient portal, but I'm going to specifically talk about the one done by Blackstone Valley Community Healthcare. So Blackstone Valley Community Healthcare, which I'm going to refer to as BVCHC, is federally qualified, Joint Commission, accredited health center located in Rhode Island, and it provides a range of services. So I'm going to basically just talk about the steps to get registered. So to get registered with BVCHC, patients basically provide their email address to the staff during an in-person clinic visit and are issued a system-generated enrollment token. Patients without emails are worked through the process of creating one with the national carriers. And the benefits of acquiring a patient portal, just to name a few: exchanging secure emails with your healthcare team, requesting prescription refills, and also being able to schedule non-urgent appointments. So yeah, those are just one of the ways that one could acquire the patient portals.
The most successful interventions for patient-centered management and coordination of care are often the most complex. They require a change of care practices as well as the implementation of new tools like patient portals. Patient portal technology creates an accessible connection between the patient and the provider to support patient-centered care. Overall, patient portals may offer one or more of the following functionalities: access to variables within the patient's EMR, the ability to print and export portal data, the ability to fill medication prescriptions or to schedule appointments, to request referrals, and access to secure messaging between the patient and the provider. By providing several functionalities, patients can see an improvement in their overall health. Research shows that 1 in 3 patients using some form of patient portal technology saw one of the following: improvements in medication adherence, more disease awareness, self-management of disease, decrease of office visits, and an increase in preventative medicine. The value of patient portal technology is found in the evolution of patient-practitioner relationship development. Empowering the patient to participate in his healthcare is an important contribution to improving the patient-practitioner's knowledge balance. Patient portal technology allows the patient complete awareness of facts related to his condition and treatment, especially in chronic care management. This is especially valuable when providers are reintroduced on how to support a patient's autonomy and include them in decision-making and trajectory. Active management of aspects of the patient's condition and shared information about needs and actions by all parties allow for targeting of interventions. In order to achieve a maximum gains of patient portal technology, patients need existing research for risk detection and management, and tools for chronic care must be readily available.
To close the discussion regarding the utility of the patient portal, it is safe to say that its instrumentation in the healthcare system has provided an exorbitant amount of convenience by improving coordination of care through allowable provider and patient access. This technology has addressed the healthcare issue of quality and access related to patient health information. The key stakeholders, specifically the provider or health network and the patient, seem to have a great appreciation for this technology. Patients can navigate through their healthcare services by examples such as self-scheduling appointments, refilling prescriptions, and viewing various procedural and lab results, while the providers can share common and more consistently accurate information that will allow for a more timely and expedient plan of care. Overall, this technological movement has kept the United States healthcare system at the forefront